Well, thank you, Andrea. I wanted to just ask you really quick, did you have just anything brief you'd like to say, some advice for people out here in the Calgary, greater Calgary area that may be on a waiting list and need a surgery right now?
Well, you know, I think everyone has to choose their own path. But I know that I was extremely frustrated sitting and waiting and looking at what the future held for us, because I couldn't be assured that even when my dad did get a surgical date, that there wouldn't be something that came up that would prevent him from getting it on that day. So I really felt that the time was now and we needed to seize this opportunity. And the other thing that I think is really important for people to understand is that even if you do get granted an OR date, you're going to have the standard old approach, which is open surgery, and there's a long recovery time associated with that. To my knowledge, there is nothing going on in this area where people can get a surgery and be up and walking in 3 days with minimal invasive technique used to do the surgery. As far as I know, in the research that I've done, the only thing that I know that's available by and large is where people are being cut open and having the standard surgical procedures done. Now, I've been told that there is endoscopic surgery here, but I haven't been told what it's being used for. But I have very little faith that the procedure that Dr. Campson is doing is being done here, because no one would answer my questions. And it has meant a huge difference, because my dad had the surgery on a Thursday and he flew home on a Monday. And his surgical site looks clean, everything is beautiful. 2 weeks from the surgical date, I mean, he's completely healed, his sutures are out, and you know, there is a recovery time to it, but it's very different. Not only that, he didn't have to have a hospital admission, which is in and of itself fraught with issues. There's superbugs in the hospital. There's, you know, if you're well enough to escape, if your immune system can't be affected by MRSA or VRE, then you have to worry about C. difficile. And my dad didn't have to worry about any of that stuff, because he went to see Dr. Campson, he had his operation, he went to the hotel afterwards, he didn't have to be sitting in a hospital bed exposed to other healthcare providers who could possibly infect him with all these other things. So, you know, that in and of itself was a blessing, which I think people underestimate. And unfortunately, the way the system's set up here now, you have to be in a hospital admission, where you don't get to go home right away and recover on your own in your own safe environment.
Yeah.